Hi, we will be discussing on advancement in critical care pediatric nursing, which is gaining momentum nowadays. Through this, we will be nurturing tomorrow's future. Pediatrics is a combination of science and emotion. Science because it improves the lives of children using the technologies, and emotion by supporting families as this is the most challenging time for families. Nurses explain medical terms in a way parents can understand. There are various opportunities in pediatric critical care nursing. There are a number of certifications in the specialty of neonatal, respiratory, trauma, and cardiovascular care. Along with this, there are diploma in neonatal nursing, diploma in critical care, as well as nurse practitioner critical care. With all the specialized courses, clinical expertise happens and it makes it easier for nurses in transition into a leadership role. The qualities of a critical care nurse. A critical care nurse must be calm while multitasking, prioritize patient needs, highly educated and skilled, must have good time management skills and organizational skills. Pediatric critical care nurses faces several obstacles. PICU nurses can feel overwhelmed and exhausted sometimes. Some of the challenges they face are managing high stress level, stay focusing in a hectic environment, focusing on holistic patient care, support grieving parents, and help parents make difficult decisions for their children. How to balance the challenges in pediatric critical care nursing. This is also a skill a pediatric critical care nurse must learn. She must focus on self-care, have an outlet to relieve their stress, establish a support network either in the setting of the hospital or outside. Frontliners of clinical research and medication trials, continuing education and leadership roles. Moving on to critical care nursing practice domains or the areas in which a critical care nurse practices. First domain is diagnosing and managing life-sustaining physiologic functions in critically ill and unstable patients. Nurses will be constantly assessing, interpreting situations, and managing multiple interventions in physiologically unstable patients. Second one is skilled know-how of managing a crisis. A pediatric critical care nurse must exhibit leadership in setting up the environment and managing multiple therapies in response to a crisis. The third area is providing comfort measures for the acute and critically ill. By creating a comforting milieu in a technologically rich ICU environment and providing comfort through presence, connection, and relationships. The fourth domain is caring for patients' families. The nurses provide information to families as well as make family involved in the care of the child. Preventing hazards in a technological environment. Engaging themselves in safety work and effectively performing the technical task and by using all the advanced devices, the nurses in pediatric critical care prevent hazards. The next domain is end-of-life care and decision making. There is always changing communication and transition from curative to palliative care and providing effective palliative care for the dying child in a pediatric critical care unit. Communicating clinical assessments and improving teamwork. In this domain, communication between and among professionals and improve the collaborative teamwork. Next area is monitoring quality and preventing and managing breakdown. The nurses resolve conflict, resolving system failures and providing intensive care even with inadequate resources. Last domain is skill know-how of clinical and moral leadership and the coaching and mentoring of others. Nurses facilitate the development of others by coaching, resolving conflict between families and staff, and transforming healthcare system. Now we are moving to pediatric critical care nursing advancements. First one is technological advancement, one of the most notable breakthroughs in pediatric critical care nursing. The integration of advanced technologies into patient monitoring systems. Real-time monitoring of vital signs such as heart rate, respiratory rate, and oxygen saturation has become more sophisticated, enabling the nurses to detect subtle changes in a child's condition promptly. This early intervention is crucial in preventing complications and improving overall patient outcomes. We will see the different technological advancements in pediatric critical care nursing. The first one is advanced monitoring systems. Continuous monitoring of vital signs has become more sophisticated with the integration of advanced sensors and wearable devices. Smart monitors provide real-time data on heart rate, respiratory rate, blood pressure, and oxygen saturation, allowing nurses to detect changes in a child's condition promptly. The way healthcare professionals monitor, diagnose, and treat critically ill children. These innovations aim to enhance the patient outcomes, improve the efficiency, and provide more personalized care. The technology is pediatric specific ventilators. Specialized ventilators are designed for pediatric patients, often ensure precise control over respiratory support. These ventilators take into account the unique physiological characteristics of children, offering tailored settings for optimal ventilation. Third one, telemedicine and telehealth. Telemedicine technologies enable remote consultations, allowing pediatric critical care nurses to collaborate with specialists and provide timely interventions. Remote monitoring tools enable healthcare providers to keep track of patients' progress, reducing the need for constant bedside presence. Electronic health records. Digital health records streamline the documentation process, providing nurses with instant access to a child's medical history, treatment plans, and medication records. Electronic health records facilitate seamless communication among healthcare professionals, leading to more coordinated and efficient care. Simulation training and virtual reality. Simulation technology allows pediatric critical care nurses to practice and enhance their skill in realistic scenarios without putting patients at risk. Virtual reality training programs provide immersive experiences, helping nurses gain confidence and competence in managing complex situations. One at the top, the picture shows a simulation, and the bottom shows virtual reality training programs. Next technological advancement is pharmacogenomics. Advances in pharmacogenomics enable healthcare providers to tailor medication regimens based on a child's genetic makeup. This personalized approach minimizes adverse reactions and optimizes the effectiveness of treatments. Point of care testing. Portable diagnostic devices enable quick and on-the-spot testing, reducing the turnaround time for critical laboratory results. Point-of-care testing enhances the efficiency of diagnosis and allows for rapid decision-making in pediatric critical care settings. You can see at the patient bedside itself, they are checking all the lab values. Next is robotic assistance. Robotic technologies assist in surgeries and other procedures, offering precision and minimally invasive techniques for pediatric patients. Robotic platforms can be controlled by skilled healthcare professionals to perform delicate tasks with enhanced dexterity. The next important advancement is specialized equipments. The development of specialized equipment tailored to the unique needs of pediatric patients has been a game changer. Ventilators, infusion pumps, and other critical care devices designed specifically for children ensure more accurate and effective treatment. The shift from adapted adult equipment to pediatric specific solutions minimizes the risk of complications and enhances the delivery of precise age appropriate care. We will move on to see the different specialized equipments in pediatric critical care units. First one is pediatric ventilators, which already we have discussed. These are designed to deliver controlled and precise mechanical ventilation to support the respiratory system in critically ill children. Second one, hemodynamic monitoring devices. Invasive monitors such as arterial and central venous catheters help assess blood pressure, oxygen levels, and cardiac function. ECMO, extracorporeal membrane oxygenation. It provides temporary life support for children with severe cardiac or respiratory failure by oxygenating the blood outside the body. Infusion pumps deliver accurate and controlled administration of medications, fluids, and nutrition. Pulse oximeters measure oxygen saturation in the blood, helping monitor respiratory status and the effectiveness of ventilation. Cardiac monitors continuously monitor heart rate, rhythm, and other vital signs. Temperature management devices include warming or cooling devices to maintain optimal body temperature in critically ill pediatric patients. Point of care ultrasound POCUS. Portable ultrasound devices aid in quick and bedside imaging for assessing various conditions. Intracranial pressure monitoring. It's crucial for children with neurological issues. These devices measure pressure within the skull to manage brain-related complications. Nitric oxide delivery system is used for children with respiratory issues. It helps improve oxygenation by dilating pulmonary blood vessels. Continuous renal replacement therapy (CRRT) provides continuous support for children with acute kidney injury, maintaining fluid and electrolyte balance. Pediatric resuscitation carts are equipped with emergency drugs, airway management tools, and other supplies for immediate response to cardiac and respiratory arrest. Even though we have all these technologies and specialized equipments, we move towards the minimum safe intervention in pediatrics. That is, the use of less invasive therapies, particularly respiratory support, in which technologies such as high flow humidified nasal oxygen, nasal continuous positive airway pressure, and non-invasive ventilation strategies with physician supervised monitoring is done. Education and training. This is the third advancement. Advancements in education and training for pediatric critical care nurses have played a pivotal role in shaping competent and confident healthcare professionals. Interdisciplinary collaboration is emphasized, fostering effective communication and teamwork among healthcare providers. Simulation training, utilizing advanced technology, allows nurses to practice and refine their skills in realistic scenarios, ensuring preparedness for the complex challenges they may encounter in the critical care setting. Education and training in advanced pediatric critical care nursing. Continuous learning and staying updated on the latest developments in pediatric critical care. First one is pediatric critical care nursing education. This is a parallel track that runs alongside medical training. Specific training to manage critically ill children, administer specialized medications, and use advanced monitoring equipments. Second one in education is simulation training. Simulated scenarios provide a safe environment to practice critical care skills and decision making. Includes managing emergencies, using specialized equipment and teamwork. Third one, advanced life support courses. Healthcare providers undergo advanced life support training such as Pediatric Advanced Life Support (PALS) and Advanced Trauma Life Support (ATLS). These courses cover critical care interventions in pediatric emergencies. Ongoing continuous medical education (CME) and continuing nursing education (CNE). Regular participation in CME and CNE activities help professionals stay updated on the latest advancements, guidelines, and research in pediatric critical care. Research and publications. Involvement in research projects and publications enhances understanding and contributes to the advancement of pediatric critical care knowledge. Through participation in clinical trials, case studies, or original research. Multidisciplinary training. Collaborative training with various healthcare professionals including physicians, respiratory therapists, pharmacists, and social workers ensures a comprehensive approach to pediatric critical care. Team-based training. Emphasis on effective communication and teamwork is crucial in critical care setting. Interprofessional education and team-based training improve coordination, and patient outcomes. Ethics and communication training. Given the sensitive nature of pediatric critical care, training in ethical decision making and effective communication with patients' families is vital. Research and evidence-based practices. These are also advancements in pediatric critical care nursing. The field of pediatric critical care nursing has witnessed a surge in research endeavors, leading to the establishment of evidence-based practices and protocols. This research-driven approach ensures that interventions are grounded in the latest scientific findings, promoting the delivery of high-quality, evidence-based care. The continuous pursuit of knowledge in pediatric critical care contributes to the ongoing improvement of patient outcomes and the refinement of nursing practices. Research in pediatric critical care nursing. Through a commitment to ongoing research and the application of evidence-based approaches, nurses contribute to the continuous improvement of care delivery. It involves inquiries aimed at understanding, improving, and optimizing care for critically ill children. The first area of research in pediatric critical care nursing is clinical effectiveness studies. Research studies that assess the clinical effectiveness of interventions, treatments, and nursing care practices in pediatric critical care settings. These studies inform nurses about the most efficacious and evidence-based approaches to patient care. The second area of research is outcome studies. Investigations into patient outcome provide critical information about the impact of nursing intervention on the health and well-being of pediatric patients. Understanding outcomes help refine nursing practice for better results. The third research area is patient and family experience research. Research in this area explores the psychological, emotional, and social aspect of pediatric critical care. By understanding the experiences of patients and their families, nurses can tailor their care to address holistic needs. The fourth one is technology and innovation research. With advancements in medical technology, research in pediatric critical care nursing explores the integration of innovative technologies into patient care. This includes studies on the use of advanced monitoring devices, telehealth, and other technological interventions. Moving on to evidence-based practices in pediatric critical care nursing. Evidence-based practices are crucial for providing safe, effective, and patient-centered care. They integrate best available research evidence, clinical expertise, and patient preferences in decision making. First one in evidence-based practice is guideline implementation. Pediatric critical care nurses utilize clinical practice guidelines derived from rigorous research to inform their decision making. Guidelines offer standardized approaches based on the latest evidence, promoting consistency and quality of care. Second one is medication administration practices. Evidence-based medication administration practices ensure safe and accurate drug administration in pediatric critical care. This includes dosage calculations, administration protocols, and monitoring for potential adverse effects. The third evidence-based practice area is infection control strategies. Infection prevention and control practices are informed by evidence-based guidelines To minimize the risk of healthcare associated infections, nurses follow established protocols for hand hygiene, aseptic techniques, and isolation precautions. Next, pain management protocols. Evidence-based pain management practices guide nurses in assessing and addressing pain in critically ill children. This includes the use of pharmacological and non-pharmacological interventions tailored to individual patient care. Family-centered care approaches. Research on family-centered care informs evidence-based practices that prioritize the involvement of families in the care of pediatric patients. This approach recognizes the importance of family dynamics and collaboration in the healing process. Yes, with all this advancement in pediatric critical care nursing, our motto is enhancing the quality and safety of care in the pediatric critical care setting. Thank you.